as the moderator tonight, I would like to take a moment to allow our panelists to introduce themselves. And Dr. Taylor, I will start with you.
Hi, I'm Dr. Linda Taylor, and I'm an emergency medicine physician at High Point Medical Center, now Wake Forest Baptist Health. And I am on the front lines of seeing the COVID pandemic.
Right, we appreciate your presence here tonight. Dr. Buford?
Hi, my name is Wayne Buford. I'm a pulmonary critical care specialist. I'm in the High Point area for over 30 years. I'm not on the front line as much as my colleague, Dr. Taylor, but I see the aftermath.
Wow, Dr. Buford, thank you, and we appreciate and look forward to your perspective. Dr. Van?
Yes, thank you so much. My name is Dr. Yulia Van. I'm the Public Health Director for Guilford County. And for the last year, I have been leading the COVID-19 response for our communities in partnership with our emergency management team. And we have been doing case investigations, contact tracing, testing, assisting a variety of different entities with prevention strategies for COVID-19. We have been enforcing the executive order of the governor in Guilford County, and most recently, we have been very much involved in the COVID-19 vaccine deployment for our communities. And it's an honor for me to be with all of you tonight.
Thank you, Dr. Van. Good to see you. And Dr. Bland.
Hi, my name is Dr. Vita Bland. I'm a hypertension specialist and family medicine doctor in Greensboro, North Carolina. And I am on the front line also, and I'm very honored to be here.
Yes, good to have you. Thank you so much to all of our panelists. So panelists, how I'm going to start off is I will ask some questions that will start off directed to specific people. And if someone wants to add on, feel free to jump in. But later on, I will have general questions for anyone to respond to, okay? Okay, so Dr. Taylor, I'm going to start with you. I know this has come up often, but it is still coming up. And that is the vaccine safe? And how does the medical community know that it's safe? If you wouldn't mind addressing that for us.
Well, it's definitely safe. From what we have seen so far, there has been very minimal side effects, if any. Most people get a little bit of soreness in their arm. Some people feel a little bit of aches and a little bit of headache, but it doesn't last more than 24 hours. And the fact that it's given us the opportunity to develop antibodies to the virus so that if you do get the virus, because there's still a small chance that you can get it with the vaccine, you won't have as much of a poor outcome from the actual disease. So I think that, you know, if you're looking at getting the disease versus getting the vaccine definitely outweighs getting the disease.
Okay, okay, thank you.
I'm sure in the near future, we will be able to see that the case load will go down dramatically as we get more people vaccinated.
Okay, thank you. So this notion of this being a rush job, is that inaccurate, would you say?
Well, I think it's definitely inaccurate. I think they've done justice to the studies and you know, what they have done so far to actually look at how the vaccine is operating and incorporating into the body itself. You know, in the past, the FDA has always taken years to study things, but for this particular situation, there was an emergent need. Yeah. And I think that the scientists have done due diligence in making sure that it is safe and efficacious, as I should say.
Okay. Dr. Taylor,
I would like to point out that what she says, And the good thing about this is that this science is just not applied to this particular disease process and viral illness. This will apply to a whole lot more viral illness that's out there now with this new technology that they have. So we should see some benefit with the technology with hepatitis C, HIV, and other disease processes.
Okay, wonderful. Thank you, Dr. Buford. Anybody else want to add any points along those lines?
If it would be okay if I could just jump in for just a second, since we are talking about the novelty of the vaccine as well as the safety of the vaccine. So as far as the safety is concerned, on top of what Dr. Taylor had already mentioned, I think that it's important for our community to know that in those clinical trials, there have been a very large number of people that were included in those clinical trials, over 70,000 individuals. Also, the manufacturers have put a lot of emphasis on including a diverse population in those clinical trials, including both white and Caucasian individuals, but then also African American, Latinx, and other groups in order to have that very equitable distribution when it came to those clinical trials. So no corners were cut when it comes to the development of the vaccine, and those processes have been remained the same, so that safety of the vaccine remains intact. And then when it comes to the novelty of the vaccine, I think that it's important to mention the fact that this technology is not necessarily new for the vaccines that we're dealing with right now. So the mRNA vaccines, that's what they're called. Our scientists, they have been working with this technology for a number of years now, including our Ebola vaccine that has been very successfully rolled out. So even if it was a pretty fast turnaround, because a lot of that red tape has been cut and there was a lot of funding that was made available, you know, think about it. If you have the money to build a house, you're going to build it tomorrow. You're not going to have to wait a whole year to do it. So it was just a variety of different things that made it possible to happen so fast. And then all of the great scientific minds coming together to make it work. So thank you for letting me add a few points.
I also like to say that one of the things we need to remember, as Dr. Van has said, this technology has been around for about 20 years.
Absolutely.
You know, it just didn't happen right now. We've been working on this for 20 years, and it just happened to be available at the time that we really needed it.
Wow, thank you, doctors. I think that really helps clarify one of the points that continues to come up even now. So thank you for that thorough information. I want to transition a little bit to communities of color and comorbidities. Why is it, particularly for those people with underlying conditions, let's say obesity, hypertension, why they need to really consider the vaccine and what those conversations look like with those particular patients? And that's open to anyone.
So it has been proven that people with those comorbidities are getting sicker with the COVID-19 virus, and they are having much poorer outcomes. They are developing the disease to the point where they are getting the pneumonia, and they are even getting things that we're finding that are coming out later, such as, you know, blood clots and different things like that. So it is so important, because the African-American community, but just by heredity, have a lot of those comorbidities. And they are really one of the populations at highest risk, you know, for developing and having poor outcomes from the disease itself.
As a hypertension specialist and a family medicine doctor, in a predominantly African-American practice, you know, we have a lot of patients that have a lot of medical problems, and they have not always been addressed as well as they should have been. When you have medical problems, you are at increased risk for getting this disease, as we all know. So I think that this spreads light on the fact that we need to be doing better as far as taking care of patients that are in Black and Brown communities, and making sure that their blood pressure is up under control, making sure that their diabetes is up under control, making sure that we are helping them to take care of their problems, making sure that we take care of the patients that are 65 or 60 and older, and making sure that, you know, we take care of those patients. This unfortunately just spreads a light on the disparities that we have, and that we need to be doing things better. And I hope that we will learn from this, and we will be doing that better. If you are sicker, you have more problems. If you've got issues, you have more problems. It's just like with babies. When babies are first born, they have no immune system. We give them 50 million shots in the first couple of years to make sure that they're taken care of. Same thing as we get older, our immune system doesn't work as well as it did when we were younger also. So again, we need to be getting the vaccine and being taken care of. But the bottom line is this: hopefully we will learn something from this. Hopefully we will be able to take care of our populations better than we have in the past.
Yes.
Dr. Bland, just as a follow-up, what needs to change? How can we improve taking care of our populations better?
I think that the first thing that we need to do is to make sure that we have adequate care. A lot of our patients do not have adequate care. They cannot come to the doctor the way they should be coming in the schedules. I try to have my patients come in, if they are stable, every 4 months for me to see what's going on with them, with their hypertension, with their diabetes. We have to make sure that they come in and be seen on a regular basis. But if you don't have insurance, or if you have suboptimal insurance, that you may come in and then you have a bill, you may not make that appointment because that money may be needed for something else. So that is the first thing, making sure that our patients are adequately cared for. The second thing is that we need to make sure that our patients also understand what do these diseases do to you? What does diabetes do to you? What does hypertension do to you? You know, why are we concerned? Why do we want to get your numbers down? Why is this important? And making sure that our patients are educated to the fact that they know why they need to have these things taken care of. But the opportunity is most important. So many people don't have the insurance that they need to be coming in and be seen on a regular basis. This is something that can be corrected and must be corrected.
Thank you. Anyone else want to add anything along those lines in terms of communities of color and comorbidities?
I would just want to add from my standpoint, from a public health perspective, and the information that we're seeing through the health department is more at a population level, and specifically for Guilford County. It is important to mention that we do have disparities in our African-American communities in a variety of different areas, but specifically around chronic illnesses. So we know from the information that we're gathering and from the data that we're capturing that we have our communities that are of color, Black and Brown communities, suffer from diabetes, hypertension, stroke, cancer, and other chronic illnesses at a higher rate than their white counterparts. And also it's important to mention that Guilford County as a whole has a life expectancy of approximately 77 years of age. However, depending on the zip code that you live in, that life expectancy can drop to less than or more than 20 years from that average life expectancy. And the majority of times, those are the zip codes that are mainly in communities of color. So we need to have a kind of overall picture of how did COVID-19 come on top of these already existing racial disparities that we have in our community, and the fact that we need to work on the COVID-19 response, treatment, and prevention. However, just like Dr. Bland has said, we need to focus on some of those social determinants of health, access to care, and overall community health in order for us to really try to move away from those racial disparities.
All right. Well, thank you, doctors. I think all of that goes to say there are so many who cannot afford not to get this vaccine, and highlighting those reasons why. Thank you for that. As we continue to talk a little bit about equity and disparity, I want to kind of have that same conversation, but along the lines of vaccine distribution. We just had the governor in Greensboro a few days ago and applauding what Guilford County is doing, actually leading the state in getting minorities vaccinated. So Dr. Van, tell us a little bit about what is working. And what do you want to see more of moving forward?
Yes, sure. So I would want to start by saying that we knew from the very beginning that the vaccine deployment has to be very swift. That we have to really be flexible in the way that we're applying our plans, because we knew that things are going to change consistently with all of the different nuances of the vaccine distribution. But one thing that we knew for a fact is that we need to make this distribution equitable around all of our communities, and specifically our historically marginalized populations. So we knew that we can't leave this effort to chance. We knew that we can't really depend on our communities that may not have access to the internet or a device to only make appointments online. We knew that we can't leave it to chance for them to be able to make an appointment over the phone. So our entire plan around that has been very intentional and very deliberate. So we had to be concrete in how are we going to do this. And we very much apply data, just like we do in so many other cases. And we identify our demographic distribution in Guilford County. And that is approximately 40% minority population, including African-American, refugee, Latinx community members. So we took that percentage and we said, okay, we don't know exactly the allocation how that allocation is going to look like for us from 1 week to another. 1 week, we might get a certain number of vaccines. The week after that, we might get less or more, but we will continue applying this percentage to the number of doses that we're receiving every week. So we set aside 35 to 40% of our appointments / doses to our historically marginalized populations. So that's one step. And in order to meet that, we work with community-based organizations, with faith-based community, with leaders in our Black and Brown communities to really educate the community and then finalize it with an appointment. So we prioritize those appointments within the framework of the North Carolina DHHS that has put together. So we're not moving through the groups at this point. So they still need to meet that criteria, but we're using this reverse callback in which we're the ones reaching out to the individuals that express the interest in a vaccine. We're filling those 35 to 40% of our appointments. And that's how we're able to really not only meet our goals, but also exceed them. So this is one of the strategies that has been identified as a best practice, and for Guilford County to be a leader in the way that we're addressing the vaccine equity distribution. So we know that we need to continue to do this. We need to continue to be intentional. We're also addressing this in a very similar approach with our Latinx community members. And we have some additional strategies there because we know that there are some additional challenges with this community. The mistrust and some of the fear that exists in these communities, we need to make sure that we're addressing those first before we can really expect for that community to trust us going forward. So that's just a summary of how we're addressing the equity distribution of the vaccine here in Guilford.
Okay, thank you, Dr. Van. And doctors, for everyone, what are some of the challenges you're hearing in terms of misinformation? Are people just looking at information from the wrong sources? What seems to be the disconnect or the barriers that you're seeing with your patients directly?
There seems to be a lot of distrust. There seems to be, if there's any reason that some people can come up with why not to take it. People have told me, and someone even sent me a video that talked about that there were little quote unquote things inside the vaccine that was going to be able to tell where you are at all times. And I reminded them that the reason people know where you are is this right here. Okay. But people believe that, but it has to do with distrust. It has to do with Tuskegee. And we have to educate people and understand that this is not Tuskegee. We have people who are in charge, who look like us and have our backs, you know, and that they're not going to put us in danger. So trying to educate people, letting them know that this is safe, letting them know that because you are, and I'll just be totally honest, I'll say you're fat, you're older, you're diabetic, you're hypertensive, and you need to get the shot, you know, and trying to help them understand why they need to get this shot. You know, have been the things that, you know, that I have seen personally in my practice. And we've been able through time, and the problem is time, that you may not have that time to sit there and really go over each and everything that they're talking about. But sometimes we can talk patients into, okay, let's getting it done. Let's go ahead and get this done. This is what you need to do. But it has to be from a person or a source that they trust. Trust is so very important. And I think if we can just get people to understand, you know, I think, you know, if I ask them to do it, they know, hey, you know, girlfriend's in my corner. She's not out to help hurt me in any way, fashion, or form. So they may look at it a little bit differently than maybe if someone else says that to them who they don't know or who they have no history with. History is important, that, you know, and I give accolades to Dr. Van for going to the source and, you know, going to the African-American and the brown and, you know, Black communities, and making sure that trusted people were the people who were recommending that they get the shots.
I also try to remind them that when they're looking at Tuskegee, this vaccine is being given to everyone. There is not a particular race that they have picked and chosen to give this vaccine. They're giving it to everyone. So do they really think that this would be something that was not, or was going to be an experiment on them, if they're also giving it to the Caucasian people and the Latinos and everyone? They're giving it to everyone. So there should not be that part of it. I don't understand, because I think that clearly you should be able to see that they're giving it to everyone. But I am still, just like you, Dr. Bland, making sure that I and other people that are trusted in the community are getting out there and letting them know that this is safe and that they need to get it.
One of my big issue about the trust system is earlier on, this was, and I always say this, and I'm saying this honestly, is that this is one in the area early on, I think us as a medical community kind of failed to a certain degree in regarding to the disease process. When we had the H1N1 problem, we had no problem. When we had the Ebola virus, we had no problem doing the proper procedures and protocols in place. Early on, this became politicized, and I think that's where one of the major problems of distrust came in, when we politicizing this disease process. And that's where the distrust comes from, because when you go on the web and you look up coronavirus, so much information comes across, and it's hard for a person who's just looking at, even from my standpoint, to disbelieve of what one person is telling me is true and what is not telling me the truth. I mean, I know certain people had to walk a fine line during the last political season, but this is one of the areas I think if we had treated the disease as was, if we had approached it when we had the H1N1 or the Ebola virus, we would be much farther ahead of the game than we are now. And in regard to the Tuskegee thing, that's one of the issues that we have right now. Most of us, I was in 7th or 8th grade when the Tuskegee Experiment ended, 1972. Most people don't know what the Tuskegee Experiment was. The only thing they think is that Black men got syphilis, were not treated, and that's it. but we were involved in that disease process also because that was at Tuskegee Institute, which is Tuskegee University. We took part in that, unknowing and unknowing. But this is a process that we can be much more engaged in compared to Hawaii was in the past. The distrust of the Black community was long before 1972, before the Tuskegee event came out. People like to point to that, but the distrust happened long before then. There are other situations that happen in the community that the distrust has passed on from your great-grandma to your grandma and to your mother and to your parents and to myself. So I know the Tuskegee event keeps coming up, but
There are many things.
there is many things
Right.
that has happened, because most of this panel that I'm looking at, when 1972 was around, most of y'all were not even born.
Thank you.
Oh, goodness. Yes, well, excellent points, Dr. Buford, especially because the uniqueness of the political factor, that does not come up a lot, but I think that is absolutely spot on. So you're fighting this on two fronts, medically as well as socially and culturally, perhaps. So great discussion, doctors. We are approaching 6:30, and I do want to allow our audience members an opportunity to get their questions answered. I will turn this back over to LaToya, our leaders, to see if there's anyone on the line. I see there may be a few people in the chat. How we want to maybe get some of these questions answered.
All right. Well, we also have a text number. If you have your flyer, there is a text number that you can text if you're not available via Skype online. If you're by phone, you can do that as well. I'll start with, it looks like we have a question in the chat. The first one was, why do we have COVID vaccine disparities between African Americans and whites?
And I'll try to just start there just a little bit, because we did identify that early on, and I think that overall as a state we're still really struggling with that. I think that we're doing a better job in Guilford County, but we still want to make sure that we continue that that work. So I think that one of the reasons behind that is because sometimes we don't necessarily think about this work as deliberate work, and taking those decisions early on and making sure that we're we're looking at the entire process with the just racial equity lens in the way that we're addressing things. Also, I think that some of the mistrust and some of the vaccine hesitancy also exists in this group. Probably not more than in other groups, but it's just something that we really need to take into consideration. So it is just a combination between the professionals and the way that we approach it, but then also how do we have these really honest and transparent conversations, because just like you guys are saying, yeah, Tuskegee study has been, probably one of the most popular conversation topics, but, of course, we continue to have, conversations about the eugenics project and Henrietta Lex cells. And, so there have been a variety of different areas that, truly happened and, created that. Just like Dr. Buford said, it didn't start just with the Tuskegee study. But what I want to mention is that from all of those unethical approaches, we have learned a lot, and the medical society has made, and the scientists have made a lot of strides and a lot of positive change in the way that we really address these issues. That's where the IRB has been instituted, the group that analyzes every study to make sure that it's ethical and all of those processes are equitable, and there's no concern about that. We have put together committees and groups that are looking at these things. So we have learned a lot from this, not to make these mistakes again.
And I think also when the vaccine first started rolling out and you didn't realize that there was going to be so much disparity. You've learned that over time. And so now you can look at those disparities and know how to put the vaccine, where to put the vaccine, and how to allocate the vaccines between the different populations.
Westbury neighborhood, right up through the middle of the country, tractor trailers pulling up I-75.
If someone can mute, I'm not sure where this is coming from, but there's a TV in the background. Please mute.
Thank you. No, I thought it was gone.
4 million without power.
Okay. Okay, thank you.
And I was just saying, it's a learning process for us too, and for you all too, to know where the disparities are and how to, and it's a changing process every day on where you need to allocate the vaccines and who you need to allocate them to and how they need to be distributed. So, you know, it's a process.
Thank you for that. There is a question that says, what are the side effects of the vaccine and when is a person considered to be safe from COVID after receiving both doses?
So most of the side effects that I have witnessed personally, just by, you know, watching people getting the vaccine, is that definitely you have a little soreness in your arm, just like if you get the flu shot. That usually goes away within 24 hours. There have been people that have developed a short-term fever, headaches, body aches. That primarily has occurred with the second vaccine, not as much with the first. And then, but those are very short-lived. Tylenol takes care of that pretty much. And you're supposed to be pretty much 95% with immunity by 6 weeks. So you get the initial vaccine, you get the second one 21 days later, and at the end of 6 weeks is when you're supposed to have developed enough antibodies to be at least 95% effective.
And to just add a couple of things to what Dr. Taylor mentioned, I think that we need to make the difference between what is truly a side effect and what is really your body reacting to the vaccine, and actually showing that your body is starting to ramp up and that immune system is really starting to work. So, you know, when you do have those local, you know, pain at the site of the injection, and, you know, those are things that, you know, we're all used to in majority of the vaccines, and somebody has it, somebody doesn't, you know, it depends. But then when you're talking about those, you know, maybe a day or two of not feeling extremely well, maybe a little tired, maybe a little headache and fever, that is really your body telling you that the vaccine is working and your immune system is waking up and it's starting to work. So those are not necessarily considered side effects. It's just not a well-being feeling altogether, but it's just a good sign, you know, actually. And then when we're talking about some of the concerns that people have around long-term side effects, I think that that's also a conversation that we need to have. In general, when we're talking about the history of all of the other vaccines that we have, we don't have any supporting evidence to show that any of the vaccines have any type of long-term effects. If there are any type of effects, those are mainly within the first month or two of the vaccine. And at this point, all of the clinical studies have way past those first 2 months of studying. And at this point, we have millions of people that have been vaccinated. So as the manufacturers are still looking at that, there are no concerns when it comes to long-term side effects. So I feel like it's important to mention that as well.
One other very important thing I wanted to make a note of is that there was a couple of things I've heard on the news where people got the vaccine and then they say, oh, a week later they got the COVID-19 disease. Well, it takes that whole 6 weeks for you to develop those antibodies. And those people that got the disease in a few days after taking the vaccine had actually been exposed to the disease before that, and they were going to get the disease Anyway, it did not come from the vaccine. It came because they were exposed to someone that had the disease and their body had not had that 6-week time to develop those antibodies.
The side effects from my standpoint of view is and one thing you need to point out, because people keep thinking that if they had a side effects from the flu or a side effects from the H1N1 or any of the shots, is one thing you have to make sure that this is not an egg-based product. So this is not one of the things that you should use as an excuse that not to get the vaccine. So that's one of the main things that you need to have patients be aware, that this is not a egg-based product like the flu vaccine. And so you're not going to get any side effects from our allergic reaction from that standpoint of view. And whatever reaction that you've had from the H1 or from the flu vaccine, pretty much you should expect to get the same type of response, because that's how your body is going to respond, as you mentioned earlier. To my knowledge, and not from my staff or from my patient, anyone has had a major reaction from the vaccine. And I think we have over 250 people in my staff that have gotten the vaccine, thanks to, I have to plug Wake Forest University. We have gotten that have not had no side effects from it so far.
Okay, I'll move to the next question. Will the vaccines be available?
Bland wanted to mention something.
Okay.
Oh, go right ahead. I'm sorry.
Yeah. One other thing I wanted to mention was that we've seen people who have gotten the vaccine and then they have passed away. And people bring that point out. And a lot of times we need to recognize that, especially when we're talking about elderly people or people who have disease, they may pass away. I think when Hank Aaron got the disease, Hank Aaron passed away. They were saying that he had just gotten a shot and all that. It had nothing to do about it. I think the studies have shown that there have been like 400 and some odd people who have passed away after getting their first injection, but it was something that they felt was going to happen anywhere. It had no bearing on the vaccine.
Thank you, Dr. Bland. That's great information. We have another question. Will the vaccine be available for all essential workers? For example, social services, housing authorities, Salvation Army, daycare centers, those that work with the public. And I guess maybe a question is maybe how soon will these be moving up the list at all?
And I can just start talking about that because we do have these questions coming up a lot. And let me start by saying that we are following the North Carolina DHHS recommended framework for vaccine distribution in Guilford County specifically. At this time, the first two groups that are eligible for the vaccine are healthcare workers, staff and residents in long-term care facilities, and then the community members that are 65 and older. These are the first two groups that are active right now. On February 24th, our educators are going to become eligible for the vaccine as well. Educators mean individuals that work face-to-face with kids in the K-12 setting, both in public and private schools, as well as charter schools, and also daycare personnel. So those are the community members that will become eligible at the end of the month. And then on March 10th, we believe that the state is going to move forward opening the group 3 eligibility for all other essential workers, frontline personnel. That is a very long list of categories. It includes law enforcement, it includes the grocery stores workers, manufacturers, plant-based workers, meat distribution, and so on and so forth. I can go on and on about it. So we're hoping that probably March 10th is going to be the time when these groups are going to be eligible. However, one thing that I need to continue to repeat so we can really all be on the same page when it comes to this message, that our allocation and our supply of the vaccine right now is extremely limited, and we know for a fact that we do not have enough vaccines to vaccinate everybody that is interested in getting the vaccine and is eligible to get the vaccine. And just to kind of put it a little bit into perspective, Guilford County has between 75 and 85,000 individuals that are over the age of 65. So far, we have vaccinated a little over 20,000, probably 25,000 altogether. So we're not even close to even completing that group 2 when we're going to go into phase 3, into group 3, let's say. So continue to have that patience and continue to wait for your spot, because there is a spot for everybody. We just need to move through this phased approach. So these are some of the really hard logistical challenges that we're having with the vaccine supply that right now is very low compared to the demand that we have.
Thank you so much for that answer. Our next question: are individuals who are free from any underlying medical conditions equally encouraged to get the vaccine?
Yes.
Absolutely. Even if they have no underlying medical conditions, they
Yes.
still die from this disease.
Absolutely.
That's right.
Yeah, they should get.
Yes.
Remember, as you get older, also your immune system does not work as well. And so just the fact that you're getting older means that you need to get that vaccine.
Thank you. Our next question, one of our participants says, I have seasonal allergies and I am very sensitive to products that give off gassing. Should I be skeptical about taking the vaccine? My doctor has her concerns. I wasn't going to take it. I have taken the flu vaccine for over 15 years diligently.
For people who have seasonal allergies or allergies of any kind, or any people who have history of COPD, emphysema, people who have asthma, yes, it is still recommended that you get the COVID vaccine. There is no adverse problem with your underlying illness of taking this vaccine. In fact, people who have chronic illness of any kind should be taking this vaccine. An illness does not preclude you from taking this vaccine. That needs to be quite clear. No illness preclude you to have the vaccine. Even some of my oncology patients meets the criteria. They will be getting the vaccine too, if they're over the age of 65 or 75. So no, there is not really an exclusion criteria for this vaccine at all. Area that I don't touch, which is not my forte, is OBGYN. No, I can't answer that. But any part of respiratory illness, allergies, heart conditions should be taking this vaccine.
And they are actually at higher risk of getting the pneumonia and getting sick from the disease.
Correct.
Thank you. Our next question or statement was, Dr. Taylor, I missed your answer to the question of how long after taking the second vaccine does it take to get to 95%?
Okay, so it's the whole process together is about 6 weeks from the first vaccine to you getting the 95%. So you're getting the first vaccine and the second vaccine is given 21 days later. So it's probably about another 3 weeks after the second vaccine before you get to that 95%.
And to just add one more thing, that 21 days or 28 days, depending on the product that is being utilized. Guilford County has both products, both Pfizer and Moderna. Pfizer is 21 days, Moderna is 28 days.
Yes.
Thank you. Must you be a resident of the county to receive the vaccine from Guilford County?
No, residence is absolutely not a barrier in receiving the vaccine. This vaccine has been paid for with federal dollars, so it does not matter where you live. We are not asking for ID. We're not verifying residency. We just need to make sure that we have some identification data, just name and date of birth, just to make sure that we're, it is a medical act. So we just need to make sure that we have that very basic information. So no residency requirement.
Thank you. We have a question from the phone line. So Janet.
Okay, so I had a question that was texted in. It says it's for Dr. Wayne, Dr. Wayne Buford. Why does Wake Hospital only give vaccinations to current or former patients? This is a statement on the patient's notice, and my wife was denied the opportunity to get an appointment. Help us to end this discrimination, which leads to our distrust.
I'm not quite sure. I hear the particulars on that one. If someone, you were denied a vaccine?
That's what the text says. It says they were denied because they're not a former or current patient of Wake Hospital.
When Wake did their rollout, and Linda, you can help me with this, it was given to the essential workers at the hospital employees predominantly. And I did know that Wake Forest did offer, and this is why Wake Forest offered to us, because I'm not part of Wake Forest. They didn't want the vaccines to go unused, so they called over to my office and offered to our employees to get the vaccine. So that's why I appreciate them for doing that. Now, in regarding to a situation as you described, I cannot answer that because I'm not aware of it and I'm not part of that Wake system in regard to who was refused and who did not get the vaccine.
I think what she is saying is that people that are patients of a Wake Forest doctor in Guilford County were able to get their vaccines through the Wake Forest system if they met the criteria of the over 65. But if they were not a patient of Wake Forest, say if their wife was, but they were not, then they were not able to get the vaccine. And I don't know for sure if that is just the amount of rollout of or number of vaccines that they have. I know there's a lot of other community resources that people can reach out to get the vaccine, not only the hospitals, you know, so I can't answer that question for sure because I'm not sure on that information. But I think from my understanding is that it was rolled out to the people that were patients of Cornerstone or Wake Forest Baptist Health.
Thank you, Dr. Taylor. Thank you, Dr. Buford.
Okay, our next question. Have you as physicians taken the vaccine?
Absolutely.
Dr. Taylor was the first. And I've had both.
I have too.
I have two also.
And I am not providing care to healthcare. I mean, I'm not considered a healthcare worker. I do not see patients. I'm more on the administrative side. I do have the ability to work from home a lot or stay in my office. I am not over 65, so I do not feel like I meet the criteria as far as the rollout is considered right now. I know that I'm waiting for my spot, and when my spot as an essential worker is going to come on March 10th, I will be extremely happy to roll my sleeve up and finally get it. So I'm very excited for that day.
Thank you. Will additional sites and locations be put into place for people to get the vaccine?
I think there are several places trying to get, I know a lot of the urgent cares are trying to get the capability of doing the vaccines, and a lot of community organizations are trying to set up places where they can give out the vaccine. So definitely that is really something that is being looked at right now, is other facilities to utilize to roll out the vaccine. And like I said, the urgent cares are one of the biggest ones. Then they need, and in the pharmacies, the big pharmacies such as the Walgreens and the CVS's got to get involved and get that going from their perspective as well.
Yeah, and I think that one thing it's important to mention that actually Walgreens, I believe, opened 13 sites in Guilford County as of last week. So there are several locations in our community where Walgreens offers vaccines. Of course, our healthcare systems, both Wake Forest and Cone Health and the health department offer the vaccines. We know that our local federally qualified health center, Triad Adult and Pediatric Medicine, is also hoping to become a provider soon and be online to administer vaccines, as well as our large universities, North Carolina, A&T, and UNCG are also going to be part of that process.
Right.
So we're very happy to see additional providers coming on board, because we know that this is really truly a village effort. So we need all hands on deck. We need all of the support that we need, as long as we have the vaccine. So that is going to be a really important piece in that.
I think they worked out a lot of the challenges of preserving the vaccine, and that was a lot of the kind of hesitancy on some of the particular medical facilities on actually rolling out the vaccine because of how you had to store it and freeze it and things like that. But I think they're getting through those processes, and you're going to see that there's a lot more facilities that are going to get and take part in giving out this vaccine. They realize it's the only way they're going to reach millions of people in a short period of time.
Thank you. I know we're getting close to the time. We have a couple of more questions left. The next one is, how about undocumented people? Can they get vaccinated as well?
As I've mentioned before, we do not have a residency requirement, and we are not requiring any type of documentation that says anything.
Thank you. Why do providers request health insurance cards?
I can chime in on that if anybody wants to add anything to it. But one thing, it's important to mention that different organizations and specifically some of our government entities, such as the health department, such as our state health department, have received funds from the federal government to roll out the vaccines. And then that is really part of our mission and part of the work that we're doing as a service to the communities that we're in. However, we know that other providers that are coming on board to provide this very important piece to the COVID-19 resolution, they did not receive any type of funding for this other than the actual vaccine, which is free. But the work that is being put in and the time that staff puts in is not really covered by any additional funding. So when somebody has insurance, they do have the ability to really gather a fraction of that cost to be able to continue those operations. If somebody does not have insurance, that does not stop anybody from getting the vaccine, because they do have another way of trying to get some reimbursement from the federal government. But it's just a way to continue their operations and to get some type of funding for the staff and the time and the resources that they're putting together, since they did not receive any type of support, any type of funds for these efforts. So that's one of that's the main reason why providers are billing insurance. But nobody should pay anything out of pocket for the vaccine. If any, that's one of the scams that we're being aware of right now. Nobody should ask for you to pay anything for the vaccine. The vaccine should be at no out-of-pocket cost to anybody, to everybody.
Okay, we'll take this last, we have 2 more questions left and then we'll close out. Are churches being considered for site locations to give out the vaccine?
Since this again is more of a logistical question, I'll take it. But yes, we've been in conversations with a variety of different churches. However, because of those logistical challenges with the vaccine and the temperature requirements and that cold chain, ultra cold chain process that needs to be followed, we really try to have the mass vaccination sites, and as a health department, that's where best at, that's where we're practicing, that's what we're trained to do, and those are the areas in which we excel. But as we continue to receive more allocations and we're getting more vaccine and more providers are coming online for this, that is absolutely part of our future plans to continue having these conversations with our faith-based organizations, since we know that those are the places that people trust and have comfort in. So, you know, knowing that those places of worship turn sometimes into places of service, just like one of our very good friends in one of our faith-based communities says, I think it's very important to continue those conversations.
Thank you. And our final question, if no ID is required, how is the first and second shot monitored accurately?
I hate to kind of take it away from everybody, but we are utilizing a system that is called COVID-19 Vaccine Management System. We call it short CVMS, and we put in the information that the person shares with us, so their name, date of birth, phone number, and address. But that is basically what they're sharing with us, just like any other vaccine. And the system allows us to identify which product they were given, create another appointment for them 21 or 28 days later to remind them to come back for their second dose, and also to remind the actual vaccinator or the person who's giving the vaccine what vaccine to give them when they're coming back. So even if we're not asking for ID, that doesn't need it. Just like I've said before, since this is a medical act, we are asking for some information, but all of that is what the person tells us. We don't need to have documentation to verify that. So we need to make sure that we're eliminating any type of barriers that anybody may have to receive the vaccine.
Thank you, everyone, for sharing information. It's been very helpful and very valuable, and we appreciate you being with us tonight. I'm going to turn it over to Mr. Joe Barnes to close us out for this evening.
Well, we're so grateful for everyone being with us tonight. We're just thankful to this great dynamic panel. Let's everybody put your hands up and give them a big wave and thank them. Come on, turn your screens on and give them a little hand clap. Come on, let's thank this great panel. We're grateful to Dr. Linda Taylor, Dr. Wayne Buford, Dr. Van, Dr. Vida Bland, and of course our moderator, Miss Natalie Wilson from Fox 8, always doing a great job. This has been a great conversation. I trust you have been informed and enlightened so that you can make an informed decision. We don't want you to operate on fear. We want you to operate on information. And if something was said tonight that you still have a question with, please reach out to us. We'll try to get it to them and get an answer. If you look at the chat, I put a survey in the chat to let you, please take that survey. We're up to like 51 folks on this Zoom tonight, this town hall meeting. This is outstanding. So please take that survey. Let us know what you thought. Let us know if we need to do this again, if this information was beneficial and time well spent. We're very thankful also to have, one of our biggest supporters, our County Commissioner, Carvina Foster. We're grateful to have her a part of our African American Initiative of the United Way. She's always there helping us out when she can. She's so busy, but we thank her and any other. The Ministers Conference, some of the Ministers Conference of High Point and vicinity are on. We thank them for joining us. And I want to thank our board, the United Way. A lot of our board members are on from the United Way. Thank you for joining us. And our president's on, Jane Leapshire. Thank you for joining us. So we're just grateful to have all of you tonight. And in the way of an announcement, please, once again, go to the chat. Fill out, download that survey, fill out that survey for us, please. I'm also going to put in the chat, we have an upcoming leadership development class starting March the 2nd. It's called Project Board Development. We've graduated over 200 individuals from that already. We want to invite you or anybody else in the community that wants to know what it's like to be on a board of directors for a nonprofit, to sharpen up your skills, or maybe you've never served, or maybe you just started serving, somebody tapped you and said, hey, I want you to serve, but you say, wait a minute, I really don't know what to do. Hey, we're going to give you the ABCs of what to do in Project Board Development. We're going to meet one Tuesday for 7 weeks for 2 hours of instruction. It's going to be by Zoom until we can get back together again, but it's going to be well worth your while. So I'm putting that in the chat as well. And you go to our website, the United Way of Greater High Point's website, that information will be there as well. So I want to thank you for your time tonight. You've been a blessing to us. We trust we have been a blessing to you. And we know that you're going away with more information than you had when you first got started. So thank you so much. Continue to have a great evening, and may God continue to bless all of you. And listen, let's continue to practice those 3 W's. I'm like Dr. Van, you know, I don't qualify yet, you know, but when my time comes, I'm waiting on my spot too. But until then, I'm gonna wear my mask. I'm gonna wait 6 feet away from y'all, just like we learned in kindergarten. And I'm gonna make sure that I'm washing my hands. All right, God bless you all. Y'all be safe, and we'll see you real soon.
Thank you.
Thank you.
Thank you, everyone, and
Put it
thank
in
you,
the chat.
participants, for joining us.
Thank you so much.
Thank you, Latoya, for running all the
Thank you.
technology, the Zoom and everything. Thank you so much.
No
Thank you
problem.
for
Thank you
having
all. Thank you so much. We appreciate you all.
Yes,
And our
thank you,
African American
Janet.
Initiative members that were on, thank you all as well for being
Thank
on.
you. Thank you for the honor.
We
Absolutely.
appreciate you.
Okay, so that link, I just put that link in the chat for you all. And so the survey is there. And then the second link is to Project Board Development with information on that. You all take care. I think we'll leave that up for a few moments to give you a chance to open that. So please go to that survey, fill that survey out, and let us know if these 60 minutes were worth your while tonight. All
And
right.
if there are other questions, if people have beyond this, is there a place that they can go to get help?
I will put in the chat our website, and you can go to our website, healthyguilford.com, to receive additional information. You can also sign up for a text message. If you text GC19 at 888-777, we always send information about vaccine availability, and follow us on social media from the Guilford County Health Department.
Thank you so much.
Thank you.